Navigating the waters of early retirement and healthcare retirement before the traditional age comes with its set of challenges. And one of the big ones is figuring out what to do about health insurance before Medicare kicks in. Here's how I handled the situation. Short-term solutions. Initially, I looked into COBRA insurance to extend my employer's coverage, but that's pretty expensive and only lasts for 18 months. It's like a short-term life raft, not a cruise ship to the promised land of coverage. Healthcare marketplace. So, I turned to the Affordable Care Act, ACA marketplace. In Portland, there are various plans to choose from based on income, and while they aren't cheap, they're relatively comprehensive. Shop during open enrollment or when you have a qualifying event, and you can snag one of these plans. Health Savings Accounts, HSA. I had also been contributing to a health savings account while I was working, which turned out to be a brilliant move. Funds from an HSA can be used to pay for qualified medical expenses tax-free, which took a lot of pain out of the premiums and out-of-pocket costs. Part-time work. I know folks who have picked up part-time work partly for the health benefits. Some employers offer health insurance to part-timers, so it's not just about keeping busy or earning extra cash. Lifestyle choices. I also doubled down on my health. A good diet and regular exercise are my own form of preventive medicine. Healthcare costs tend to go up with complications from poor health, right? So, living in the green city of Portland, hiking trails and cycling are basically my neighbors. I keep it natural and as far from the snack aisle as feasible. Healthcare sharing programs. I've heard some early retirees go for healthcare sharing programs. They aren't traditional insurance but can be a more affordable way to manage medical expenses. Just be sure you understand what you're getting into and what's covered. Expatriate insurance. A few adventurous souls even consider international health insurance plans and take the opportunity to live abroad. The cost of living and healthcare can be less expensive in other countries, so that's a two-in-one deal for some. The grindstone. And then there are those who just keep working because they love what they do, or they love their company's health plan more. If the desk or the hammer isn't too heavy, more power to them. Each path has its merits and pitfalls. The key is to research, plan, and adapt. If none of these options work, there's always hope for new solutions. But until then, stay healthy and save where you can. Oregon's air might be crisp and the views breathtaking, but it's no substitute for a solid health plan. Remember, early retirement requires a map, and health insurance is one of the key destinations to chart.